A lot of parents want to follow an alternative vaccine schedule these days. They're not as comfortable with the big group of vaccines that we give babies all together at the 2-month visit and the 4-month and the 6-month visit, where the regular schedule dictates about 6 injections at each one of those visits. Some parents just want to spread the shots out. However, the challenge is to find a doctor that'll work with you and that is open to spreading the shots out. A lot of doctors aren't comfortable doing that. They're so used to the standard vaccine schedule that they're not really sure about how to spread the shots out or whether or not they want to offer that option to you. So here's how you can approach your doctor if your doctor isn't used to the alternative vaccine schedule. The most important thing is to make a separate vaccine appointment. You can't group a 15 to 20 minute vaccine discussion in with a regular checkup. Doctors only have about 10 to 15 minutes to spend with you to do a checkup. That's only enough time to examine your baby, talk about nutrition, talk about health, and a lot of the regular baby things. If you try to surprise your doctor with a list of 20 questions about the vaccine schedule and how you want to do it differently, truthfully, your doctor's probably going to get a little bit annoyed about it. Your doctor's going to feel rushed. The doctor's probably not going to be very respectful to you or very open to your ideas because the doctor has 2 more patients waiting, in their office for their appointments. I call it the doorknob question. The doctor thinks the visit's over, thinks he's done everything he needs to do. He reaches for the doorknob to leave the room, and you say, "Oh, wait a minute, doctor, I'm not sure I want the vaccines." Well, as a doctor myself, I kind of find that situation a little annoying. And of course, I do want to be patient with my patients. I want to talk to them and spend the time with them discussing vaccines. So what I ask my patients to do is make a separate appointment where we're not examining the baby, we're not talking about anything else. We can just sit down and have a nice, relaxed and long conversation for 15 or 20 minutes to talk about vaccines. If you give your doctor the respect and the time to do that kind of thing, then I think your doctor will be much more open to sitting down with you, hearing your concerns, looking at the vaccine schedule, and planning how to do it a little differently, planning how to spread the shots out. I think you'll find your doctor is much, much more open to that approach. There's a lot of debate right now on whether or not pediatricians should even offer parents an alternative vaccine schedule. Some doctors feel that it's you do the standard schedule or get out of my office, and they're not willing to give you the options. Well, I worry that if we don't offer parents the option of an alternative vaccine schedule, that fewer patients are going to vaccinate. The parents that aren't comfortable with the standard schedule that gives as many as 6 vaccines at each baby visit, I think those parents are going to leave their pediatrician's office unvaccinated. But the truth is, these parents want to vaccinate. They just want to do it a little bit differently. They want to do it in a manner that they feel safer about. And if a doctor just kicks them out of their office, and then those patients are just going to keep looking for a doctor until they find one that'll work with them. But in the meantime, the baby is left unprotected from some of the very serious diseases that could pose a risk to that baby. The American Academy of Pediatrics right now isn't too thrilled with the idea of offering alternative vaccine schedules to patients, but I feel that the very strict policy of refusing to do that is going to put our nation at risk. We're going to see more diseases. We're going to see fewer and fewer families vaccinating according to the standard schedule, and some of the illnesses that are now rare are going to start increasing and causing more problems. So I feel it's very important for doctors to be open to patients' worries, don't simply dismiss their concerns, and work with them in a way that you can put together a vaccine schedule that the patients are more comfortable with. And by doing so, we'll increase vaccination rates and be able to continue to protect our country and its children from some very serious diseases.